When I was in my residency, I was covering our ICU one day, and we got a call that a woman had come in who was visiting from out of state and was found unconscious. We brought her in, and the emergency room immediately identified that she had a fever and was having trouble breathing. I was trying to figure out what medication she was on, and I went to her husband, and the husband didn't know. He said, we were so busy packing that I don't know. I didn't really talk to her. We didn't have a chance to talk this week. I know she went to the doctor, but I didn't know what meds she was taking. So then we tried calling her doctor out of state. And because her doctor was being covered by a covering physician, the doctor said, I'm sorry, I don't know what med she's on. And this was a paper-based practice. He said, I'll see if I can find her records to find out what med she's on. But unfortunately, he didn't have the keys to the file room where her chart was. It took him about 12 hours later. He was able to contact a secretary who had the keys to the file room. And he was able to get the record, but all the record showed is that she had seen now another specialist who had recently prescribed her something, and he didn't know what it was, but she'd seen a rheumatologist. Now she had been in the hospital for, I think, 2 or 3 days as we were contacting one person to another just to try to find out what med she was on. And when we finally contacted this rheumatologist, he said, oh yeah, no, she doesn't have an infection. She has a variant of lupus. Her immune system is attacking her liver. They said, don't give her any antibiotics. That's not what she needs. She needs steroid medications to help reduce the inflammation in her liver. And so fortunately there was a good outcome, but it showed me firsthand what happens when we don't have access to the right information, because had we known that, her hospital stay might have only been, maybe a few hours, and instead it was a few days. And when I saw that happen, especially as somebody who comes from a IT background, I thought, we can't allow this to happen again. And that's how I started my career in health technology.